Hi, in this video let's discuss angular cheilitis. So angular cheilitis, it's a regressive alteration seen in oral cavity. It has multifactorial etiology. Let's discuss in detail about angular cheilitis, its synonyms, predisposing factors, differential diagnosis, and also the clinical presentation followed by treatment. So coming to the synonyms of angular cheilitis. So angular cheilitis is also called as angular chelosis and perlechi. And coming to various predisposing factors, so this angular cheilitis can be because of infection. So this infection can be of bacterial origin or fungal origin. So the most common fungus which is commonly implicated is Candida albicans in around 20% of cases, and the infection can also be of bacterial origin. So the most commonly involved organism is staph, Staphylococcus aureus, again in 20% of the cases, and the combined infection is usually seen in 80% of cases of angular cheilitis. And other predisposing factors include nutritional deficiencies. So various nutritional deficiencies such as iron deficiency anemia, deficiency of vitamin B, folic acid deficiency, etc. Another predisposing factor responsible for angular cheilitis is decreased vertical dimension. So this decreased vertical dimension is usually seen in case of adults and also in denture wearers, right? So these are some of the predisposing factors leading to angular cheilitis. Coming to the clinical presentation of angular cheilitis. So usually angular cheilitis is seen at commissures of mouth. So commissures are nothing but corners of mouth, and the lesions do not extend onto the mucosal surface, and they are restricted only till the mucocutaneous junction at the commissures of mouth, and they appear fissured or wrinkled. So because of this decreased vertical dimension, there can be formation of fissures or wrinkles, and as a result of which there can be pooling of saliva. So because of this pooling of saliva, the tissue becomes softer and it has this characteristic macerated appearance. So it appears macerated, fissured, wrinkled, and also often there is ulceration without spontaneous bleeding. This is important. And once there is ulceration, there can be formation of superficial exudative crust, right? So this is a characteristic clinical presentation of angular cheilitis, which is usually seen at the commissures of lip. Hope it's clear. And when this angular cheilitis is associated with nutritional deficiencies such as iron deficiency, anemia, vitamin B or folic acid deficiency, it's called as perlechi. And coming to treatment aspect, it is empirical. That is, the focus is not on the infection present over the particular anatomic site, but the focus is on addressing the primary etiological factors. So once these predisposing or primary etiological factors are eliminated, then obviously there will be resolution of symptoms pertaining to angular cheilitis. And also remember that this angular cheilitis shows periods of spontaneous remission as well as exacerbation. And coming to differential diagnosis, herpes labialis, it can be even ulcers because of known trauma, environmental reasons, or even syphilis. And other differential diagnoses include perioral erythema and ID reaction. So ID reaction is nothing but localized sterile vesiculopapular rash, right? So these are some of the differential diagnoses of angular cheilitis. And to summarize, angular cheilitis, it's basically a regressive alteration of oral cavity, and it has multifactorial etiology, and the synonyms include angular chelosis and perlechi. It's called as perlechi in specific when there is angular cheilitis associated with nutritional deficiencies, and various predisposing factors include infection, nutritional deficiencies, and also decreased vertical dimension. Infections, it can be either of bacterial origin or fungal origin. So the most common organism associated with angular cheilitis is either Candida albicans or Staph aureus, and the nutritional deficiencies such as iron deficiency anemia, vitamin B, folic acid deficiencies can also lead to angular cheilitis, and most importantly, decreased vertical dimension or vertical height, which is seen commonly in old age people and also in chronic denture wearers, right? So these are some of the predisposing factors, and clinical features include it's characteristically seen at the commissures of lip. On the mucosal surface, we don't find any lesions, and this lesion or infection is confined only to the mucocutaneous junction but doesn't extend onto the mucosal surface, and the surface appears fissured or wrinkled, and there is pooling of saliva giving a macerated appearance, and there can be ulceration without any spontaneous bleeding, and there is formation of exudative crust on the surface, and the treatment is empirical depending upon the etiology, and differential diagnosis includes herpes labialis, ulcer formation because of a known trauma, syphilis, perioral erythema, and also ID reaction, which is nothing but localized sterile vesiculopapular rash, right? So this is in brief about angular cheilitis. Hope it's clear. Thank you.